So define net new patients.
Okay, net new patients is taking new patients that come into your practice, and we measure this on a monthly basis. New patients in, and then subtract those patients who have left. So we're accounting for patient attrition. And that could be someone who said, I'm requesting my records be transferred. It could be death of a patient, someone's moved.
So really, you only count the ones that have left, that have literally left?
Yes,
Okay.
that we know of. So there could be others that we
What if they haven't
don't
been
know
in
of.
for a cleaning for 6 months?
6
have
months,
they left?
No, they're in a
year?
different system. But if they
Okay.
haven't been in for usually 18 months, then that's attrition.
Then you take them out.
Absolutely.
Okay.
And the reason this number has become so important, in fact, it's a number that I didn't track 15 years ago, is there's so many dynamics in dental practices today. And one of the biggest that I've seen, especially since the economic downturn, is marketing. So I'm a absolute believer fan of marketing. We must market. We must let the public know who we are and differentiate ourselves. However, some of the marketing approaches that doctors have taken definitely attract new patients, but as quickly as they're coming in the front door, they're going out the back door. And a lot of that is based on whether it be a coupon or a free exam, free x-rays, whatever that might be, free consultation. Then when it gets time for, yes, this is a treatment you need, but that's not free, those people have their freebie and they're gone. So looking at not just how many new patients we're attracting, but who's leaving helps us to say what's the net. The reason that this is so important is I've seen doctors make judgments, decisions on marketing as well as their practice potential down the road on numbers that are false. So if you're saying I get 25 new patients a month, that means my practice is growing by 300 patients a year. That means I should be able to have more days of hygiene. Let's hire an additional hygienist and so forth and so on. You end up where your practice overhead is out of line with what your revenue is. And so net new patients is a very, very important number to look at. In fact, I had a client that after things crashed in 2008, he was feeling pretty desperate. And he went with a marketing campaign that was $40,000 a year. I must tell you, we had a wrestling match. We went toe to toe. I didn't think the approach was the best, but these decisions are, of course, ultimately the doctor's. And what he found out after that first year is he had phenomenal success. He was getting on average, 32 new patients a month. And it was kind of one of those, and you didn't like this idea. Well, I said, let's look at the net. And the net was actually to the negative. And so I said, yes, it worked in the sense that it attracted new patients, but those people have come and gone as quickly as this all started. So that information, that data, that looking at this information helped him to avoid spending another $40,000 on a marketing campaign that worked in the sense that it attracted new patients, but the attrition left him with a negative net.